Hi, welcome to Pennsylvania Newsmakers, and as always, thanks for watching. Well, Medicaid and health care is constantly in the news. We have an expert here who's going to fill us in on where it's all going, and then reform in the Pennsylvania legislature. Is it ever going to occur? Tim Potts will join us for his analysis. Pennsylvania politics and government, in depth and in detail. And guess what? It all starts right now.
This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
All right, well, we constantly hear about Medicare and Medicaid and the S-CHIP program and these government programs that affect so many people, and we thought we're going to take time out today, as we've been doing repeatedly, to emphasize health care. One-sixth of the economy, is that about right?
That's about right.
It's about right. I have Dr. Jay Feldstein. He's the regional president with the Northern Division of AmeriHealth Mercy family of companies. That's a long title you guys got.
It is a long title.
But you'll just be Dr. Feldstein, and you're my expert. Is that okay?
Okay, that works.
All right, look. Medicaid program, there isn't any doubt about it. It's a huge program, enacted in 1965, part of the Great Society. Lots of folks need it and use it. What changes are taking place in Medicaid that you think our viewers need to know?
Well, I think one of the changes is that more and more states, as part of the solution, are moving towards managed care. We're a managed care company. We do Medicaid. We do Medicaid in Pennsylvania.
Now, what does that mean when you say managed care for our viewers?
Where basically the state pays us a fixed dollar amount, and we take care of the population for that fixed dollar amount.
Okay.
And we coordinate care for our members. It's like an HMO. People that were in an HMO for commercial insurance, that's how we function in the Medicaid world.
Now, the point about that is that it keeps costs from escalating because the state sets rates for you?
The state sets the rates, and it fixes their expense.
Okay.
So it helps to control costs. And over a 5-year period in Pennsylvania, the managed care companies, we were able to save the state about $2.7 billion.
Mm-hmm. Now, over in New Jersey, where you have a new governor, now he's controversial, everybody knows that, but by the way, he's still, popularity's still pretty high, despite the fact that he's taken on a lot of problems. He is considering and has implemented, I think, some Medicaid changes that are similar to those that you're talking about?
Well, they have managed care in New Jersey, but now he's going to move all Medicaid members into managed care. And he feels that that can save the state of New Jersey about $300 million.
Is that controversial?
We haven't heard the controversy. Yeah. We think it's a good thing. A lot of other states are following suit. There's about 71% nationally of all Medicaid members are in managed care plans.
So under a managed care plan, you could still, if you're a Medicaid, would you have to go to a certain facility, or are you free to pick your own doctor?
No, you still have choice. You pick your own doctor. You have a choice of your networks. The way we really impact the cost of care is by providing access to care for Medicaid members and getting them the right care at the right place at the right time.
Do you think by putting it under sort of more control and regulation, we're likely to see less fraud and less, one of the concerns about both Medicare and Medicaid is the waste and inefficiency and fraud. Would you make the argument that you think under this kind of umbrella that you're going to, be more efficient, the folks will get better care?
I definitely think we'll be more efficient in getting folks better care. Yeah. And we do a lot of work in the fraud area now, and I think we're able to do more work as it's more consolidated.
All right. We're going to run to a break. When we come back, I want to talk a little bit about how you think this relates to the Affordable Health Care Plan. Notice I didn't call it Obamacare. We're trying to be neutral and objective here. We're not taking judgments on this. We'll be back and we'll get into affordable health care. Notice that term.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Chamber of Business and Industry, the statewide voice of business, and by the Pennsylvania Cyber Charter School, bringing educational innovation and freedom to the children of Pennsylvania. This broadcast of Pennsylvania Newsmakers is presented by PAConstructionJobs.com. For more information about rewarding careers in the highway construction industry, visit PAConstructionJobs.com. And by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
Hey, welcome back. I'm talking with Dr. Jay Feldstein. We're chatting about a bunch of health care issues, Medicare, and now the Affordable Health Care Plan in our continuing series to keep you updated on major changes affecting 1/6 of the economy. And guess what? Your health care. Your physician, your hospitals, your surgeons. We're trying to do it all here. All right, look. Governor Corbett in our state, despite the fact that he was part of a lawsuit, challenging the constitutionality, the mandate, the requirement that everybody have health care, is implementing the Affordable Health Care law in our state. Is there any aspect of how that's being implemented that you have some thoughts about that you think are important for our viewers?
Well, I think we have to get ready for health care reform. When health care reform goes through, 14 million more members will be added to Medicaid. That's nationally. There are 50 million people in Medicaid now, so there'll be about 64 million people in Medicaid. In Pennsylvania, that's another 500,000 Medicaid members. And that's in addition to the people that can go on to the exchanges. So how do we...
Now, by going in the insurance exchanges, you mean where you could go and buy insurance, but you would have the ability to look at competing companies and policies across state lines. Do I have that right?
If they allow it to go across state lines. It's set up that the state has exchanges with 3 different types of policies that people can buy.
Okay.
And hopefully people will be able to take those across state lines. That hasn't been worked out yet.
Okay. But the purpose of it seems to me, in order to keep costs down, would be to allow competition across state lines and within the state as well. Is that right?
Correct.
I mean, isn't that the whole...
That's the whole idea.
Is that the whole
more
premise?
competition.
That's the whole premise. The other thing, before we go back to another, while we're on this subject, this mandate is very controversial. In some states, the governors of the states are saying, no, we're not going to implement it. Governor Corbett, as I said, is. Do you think that the whole health care law falls apart if the mandate gets struck down? I mean, everybody says you need the mandate in order to pay. Do you think that's a reasonable argument to make?
I think it's a reasonable argument. I just don't know how we get there, because the basis of all insurance is risk. Yeah. You have to spread the risk. And if you don't spread the risk evenly, then you have higher premiums for sicker populations, and then it becomes unaffordable.
That's a good point. One of the points that I thought about when we were debating this is, these young immortals. We were them. We were all. That's time, right, Doctor. Yeah, we were all young. You're going to make them pay a fine if they don't. I mean, if they don't buy the cover. It seems to me that that may be almost unworkable itself. Maybe I'm wrong. That you're going to find lots of people who are going to try to avoid it and evade it. No.
Well, that may not be the best way to get to people that everyone has to buy coverage. I agree with you. I'm not a big fan of that penalty concept.
Yeah. Well, let me ask you this. You've chatted about Medicaid and how important a piece of it is. Would it have been a reasonable alternative to affordable health care to expand the criteria for Medicaid? Let's say change the poverty formula so you include more people. Take Medicare, drop the age, take the S-CHIP, the Children's CHIP program, expand the eligibility. Could we have not covered larger, a good share of the people the president is trying to cover by just tweaking the system as opposed to...
Well, is that
a dumb question?
No. In fact, Terry, that's what's actually happened. I mean, the federal poverty level has been increased to increase Medicaid eligibility. So, in essence, that's happening.
And so the only wrinkle in it that is of some concern would be the health care mandate.
Correct.
Which is controversial, and I think you would agree. And the insurance exchanges that I think our state is in the process of setting up that's supposed to increase competition, right?
Correct.
So other than that, do you think this is ultimately just going to lead to a single-payer system in the end that we're gravitating towards that anyway?
I don't know if that is the ultimate goal or if that's where we end up. But I think the idea of making sure that everyone has some type of insurance coverage, we need to go there because we can't afford to have 50 million uninsured people.
Yeah. Let me ask. Let's talk about Medicaid and lots of folks now, seniors with low income, go into a lot of nursing homes, and talk about how important Medicaid is for that.
Well, that's the safety net for seniors. That's the long-term care safety net, and that's an area that we think managed care can be of great service to and value is, what can we do in a community to help people be in the right setting for their long-term care?
Right. And so when you go into a facility, Medicare only covers a certain, I think it's 90 days.
Right.
Is that what it is? A certain number of days, and then ultimately folks rely on Medicaid. Before I let you go, we have about 30, 40 seconds. How optimistic are you, given all of these changes, that somehow we're going to work our way through this and create a healthcare system that provides two things, access and quality?
I'm very optimistic because, A, I'm optimistic as a person.
By personality, right.
And two, we don't have any choice but to make it work.
I mean, we have to get it right.
We have to get it right.
And even if it means tweaking the Affordable Health Care Act to make it better, you think that politicians ought to be more flexible and figure out the best way and not get stuck in place?
I think at the end of the day, at some point in time, we're all patients.
Yeah.
So I think we'll get there.
Yeah, well, one of the concerns I've had is that by increasing the number of people, which, by the way, I've done polls and others, the American people support the concept of universal coverage, but they're also concerned that by adding millions, and we can argue about how many will get added, that their access and their quality will be reduced. So that is, I think, something that is a serious concern.
It's a valid concern, and I think the system, as a system, we've got to address that.
Yep.
Whether it's through more primary care residencies, more nurse practitioners, or physician extenders, but that's real.
Yep. All right. Thanks for the update. All right, Tim Potts is here, and you know what that means. Legislative reform. What ideas does Potts have? We'll tell you about that after these words.
This broadcast of Pennsylvania Newsmakers is brought to you by Pennsylvania Credit Union Association. Pennsylvania Credit Unions, where people are worth more than money. To find a credit union that is right for you, check out ibelong.org. And by the Energy Association of Pennsylvania, Pennsylvania's energy information source. This broadcast of Pennsylvania Newsmakers is presented by the State System of Higher Education. 14 state-owned universities. The state system is the largest provider of higher education in Pennsylvania. And by the Hospital and Health System Association of Pennsylvania, working towards a healthy Pennsylvania.
Hi, welcome back to the program. Well, joining me is Tim Potts. He's the co-founder of Democracy Rising Pennsylvania and the preeminent reformer and nag. You're the nag, aren't you? You get this an awful lot, Mr. Potts, don't you?
Well, yeah.
You're nagging at the legislature to doing the right thing. Do you agree with that?
Yeah, I'm nagging. They're not doing the right thing,
Okay.
and we got to turn that around. I'd love not to be nagging them. I'd love to be praising them for doing good stuff.
Well,
they just have to do it first.
Okay. Well, before we get to some of the reforms that you think they need to do, we've got the Senator Rory trial out in Allegheny County for public corruption. We have two former speakers soon to be tried. We have some sentencing coming from people who went through the prosecutorial process.
Right.
Give us a quick update about where you think what's going on with these trials.
Well, I think what it does is it establishes Pennsylvania as having the most criminally prosecuted legislature in America today. And frankly, if I were part of the legislature, I would be raising hell about that and trying to fix it. And it's indicative of the culture up there that you have very few who are seriously trying to fix it and very few who are doing it publicly. The one I can think of off the top who's really working very hard is Coach Schroeder from Chester County.
From Chester County,
His Public Integrity Commission legislation is really very good. It is the only comprehensive solution that we've seen in the 5.5 years since the pay raise.
Now, most of the trials deal with what we call public corruption, meaning that using state tax dollars for campaign purposes. They all have wrinkles on that. It could be obstruction, it could be conspiracy, but that's the core.
Yeah.
Is your sense that that aspect of it is gone?
No. I think I think it's underground. I mean, look, you had Jeff Habay, former legislator from Allegheny County, convicted of using taxpayer money to subsidize a political campaign in 2005. And what do you have in 2009? The same accusations are being made against Senator Rory.
Right.
And you've got all this documentation. It's outrageous. Even after the Habay, all of the stuff with the bonus scandal happened after Habay was convicted. And you say, look, this is illegal, you're going to get caught, you're going to go to jail. And they say, well, maybe we'll get caught, maybe we'll go to jail, we'll take the chance.
Let me ask you this question. I mean, there are a couple of things that I want to talk about, like campaign finance reform and lobbyist reform. But let's stick to sort of the ethics side of it. There have probably been at least 30 state officials in the last 40 years that have been convicted of public corruption, variations of that, and I think you would agree. You know, pled out or went to prison, you know, probation or prison, okay. Not one of them have been censured or reprimanded by the legislature. So my point is there no ethics operation that looks at this stuff and judges its own members like, don't do this, maybe this is behavior you shouldn't do?
Well, it's fundamentally flawed to ask the legislature to police itself. I mean, it's same with professions. Nobody polices themselves adequately. You're looking at the judiciary. You look at the scandal in Luzerne County, and that's because the judiciary polices itself. It does not work. And that's the beauty of the Public Integrity Commission legislation. It creates an independent body that looks at all three branches and deals with all of those ethical issues in a much stronger way than Pennsylvania's had since the Crime Commission of the 70s and 80s.
Right. We're going to run to a break. When we come back, I want to ask you specifically about this, about the financing of campaigns, where we literally have virtually no rules about what you can use campaign money on. And the other thing is I want to talk about lobbyist gift bans. We just had this incident with Senator Scarnati. I think he's a genuinely decent guy. I don't think that's the point. The question is, and I think afterwards he sort of admitted that. We'll get into all of that with Tim Potts following these words.
This broadcast of Pennsylvania Newsmakers is presented by Highmark Blue Shield, changing the way health plans work for business with a variety of plan options for employers and more choices for employees. Information is available at highmark.com. Have a greater hand in your company's health. And by the Pennsylvania Healthcare Association, the future of long-term care.
Hi, welcome back. I'm talking with Tim Potts. We're chatting about legislative reform and campaign financing and ethics reform and other. I want to go to another topic. In our state, it is legal for Tim Potts to give any amount of money to any candidate running for any office at any time, and they can virtually use it for anything they want, because the definition for use of campaign money is to influence an election, which you could drive a Mack truck through that legal definition.
And we do drive Mack trucks through there. I mean, you're using
first of all, am I right about what I just said?
Oh yeah, yeah. And you know, it's another mark of shame of Pennsylvania that we are, you know, just for sale, as well as much as we are. We have lots of reasons to do away with that. People say, well, just let all those contributions happen, and we'll just make it transparent so everybody knows. It doesn't work that way. You know, when you have the Marcellus shale industry giving the governor almost $1 million in a campaign, they expect something in return, and that's what people have to understand. The folks who give this kind of money are business people. If they weren't getting a return on their investment that was greater than their investment,
and
they wouldn't do it.
And this happens in both parties. I mean, you're using one example, but we're talking about both parties, the various groups that support them, and they're trying. I mean, let's be honest. They want influence. We know they get access, and the question is how much influence is always sort of indeterminate, right?
Right. Well, last year you had the promise by the Senate Republicans that they were going to pass a natural gas extraction tax in Pennsylvania as part of the budget deal. Gee, they get all this money from the industry, and they end up not passing the tax. Is this coincidence? I don't think so. I don't think anybody with common sense thinks that this is a coincidence.
I mean, the other side of this is that once you give the candidate money and he puts it into their campaign account, they can use it for just about anything. I think there was a case where a former lawmaker ended up taking his family, his wife and his staff, a staffer and a wife of the staffer, to Las Vegas and used campaign money, and they argued they were strategizing.
Oh yeah, it's a joke. It's a joke. You know, you have campaign money being used to pay the legal bills of people who are no longer in the legislature, cannot run for the legislature. It's just,
and you don't
it's
think
the most
that
insane system of
law. And legitimately giving contributions to candidates you favor is an honorable thing. I mean, for you or me, now I don't give them because of what I do, and you probably don't give them either.
Right. But I mean,
it's an honorable thing to give money, but when you give money to a candidate, I would expect that they would use it for the campaign to help them get elected. That's why you would give them the money, not to take trips
Right.
And not to give it to somebody else
exactly.
that you may not want.
That's not why I give people money. You
yeah.
know? I mean, giving money to political campaigns is a mark of citizenship. It's one of the things that we need to do.
I agree. It's a good thing. Yeah.
They got to be accountable for the money that we give them. If they're not going to spend it on the campaign, then give it back to me.
Now, you and I might disagree on this next one to some extent. To some extent. I want to talk about a gift ban.
Yes.
Right now, correct me if I'm right, Tim Potts could give a lawmaker anything you want. You could give them anything. And the only requirement is they must report it.
Right. So above $650.
I understand it.
So
okay.
Right.
But you could give them a car.
I could give them a car. I could give them a house.
You could buy them a house.
Right.
And
I could give them a condo in Florida. All I have to do is report it. This is ridiculous.
All right. Now, here's where you and I might disagree. We'll see where we go.
Okay,
That's all right.
sure.
We can disagree. I think there's some reasonable threshold. I don't care if you take a lawmaker to dinner. I don't care if you take them out to play a little tennis or a little golf. But there ought to be some limit beyond which it says, uh-oh, this doesn't sound right.
You can't do it. Well, I'm on the side of two-thirds of Pennsylvania voters who want an absolute ban. And I think
I'm not with you on that.
I understand.
That's okay.
That's
okay. I want to
there's probably room for compromise in here. But, you know, you look, and every time there's an exception, it devolves to the detriment of the citizens, and the citizens understand that. You give them an inch, and they will take a mile.
Right.
They'll figure out some way around it. It's like water flowing downhill. You know, it's going to go there.
Yeah.
And so it wouldn't make Pennsylvania unique to have a gift ban at all.
Now, I want to come back. The latest, occasion that made a lot of news was Senator Scarnati. He's the president pro tem of the Senate. Went to the Super Bowl, and I think went there, by a special interest, and then came back and. There was some reporting of it, and he said he would end up paying for it. And I think the senator is genuinely a decent guy who I think is trying, and got caught up in that. But do you think it's just sort of the way of the world, the culture that folks like you are trying to change, and that this is just thought of as
well, it's
kind of
the way
common?
the culture is in Pennsylvania. It's not the way it is in other states.
No, I understand.
And it doesn't have to be that way here. Yeah, but it is. It's a cultural thing. It's been around for a very long time. And the citizens are going to have to change it, whether they do it through a Constitution Convention or some other mechanism. And this is one of the places where Governor Corbett has been a real disappointment. I mean, you look at two-thirds of the people want to do something to improve public integrity. Here's the guy who campaigned, and he's not providing any leadership at all on that.
All right. Thanks for the update. All right. We'll see you next week for another edition of Pennsylvania Newsmakers. And as always, stay well.